Sure. All right. Well, hello to everyone out there. My name is Dr. Laura Crankshaw, and I'm thrilled to be here today giving you guys the next round of afternoon lectures, starting with nutrition and metabolism. And these slides have been put together by Dr. York, and I'll be presenting them on behalf of his hard work. And nutrition and metabolism is a gigantic topic. There's a lot of mathematical equations, there's a lot of principles. We'll go through the basic ones in this lecture. It's a very important topic in the ICU. We know that malnourished patients have worse outcomes, longer hospital stays, and therefore more hospital costs. So it's a big topic within surgical critical care. And we'll go through some basic principles and concepts that can be applied both in practice, but of course also on the surgical boards. All right. So starting looking at organic fuels and energy yield, there's three main macronutrients that we get energy from: lipids, proteins, glucose. So our fats, our proteins, and our carbs. And essentially, each of these substrates contain a certain amount of energy, and you can see them listed here: 9 kilocalories per gram for fat, 4 per kilocalories per gram for protein, and a little over 3.5 kilocalories per gram of glucose. And our body is going to take that energy, break it down, and then use the components for either storage or energy. And the metabolism of each substrate differs in our bodies as far as how much oxygen we consume in order to metabolize it and how much CO2 is produced as a waste. And that's what's reflected in the respiratory quotient that you also see listed here. In clinical practice, this becomes relevant because it helps guide our nutritional adjustments in our ICU patients, especially in mechanically ventilated patients. And the values, which I'm sure all of you have seen before, are listed here. In general, the glucose is the easiest one to remember because it's a respiratory quotient of 1. And essentially what that comes from is the literal mathematical equation for metabolism in glycolysis. And what's happening is we take one molecule of glucose and, or let's say, for every molecule of glucose that we metabolize, we use about 6 molecules of oxygen. And when we metabolize that, that results in 6 molecules of carbon dioxide and 6 molecules of water. And forget about the water, who cares? So then we're left with 6 oxygen in, 6 CO2 out. And when we put that into a fraction of VCO2, volume of CO2 exhaled, and over VO2, volume of oxygen consumed, we essentially get a 1. And the 0.7 and the 0.8 just come from the different amounts of oxygen going in and CO2 molecules coming out. Looking at that a little bit more closely, here's the actual equation written out. That's volume of CO2 exhaled and essentially how much oxygen we are consuming in the metabolism process of each substrate. In a healthy person, that's going to be somewhere between 0.7 and 1. An easy number to remember is around 0.8. So the way that we typically calculate this is with indirect calorimetry, which isn't possible in all institutions. But if we have a respiratory quotient of 0.7 on a patient, essentially what that's telling us is they're solely using fats. So the way that we calculated the respiratory quotient for fatty acids is, that's, for example, the most common one, palmitic acid. When we metabolize that, we use 23 oxygen molecules, and that puts out 16 CO2 molecules. That gives us a fraction of 0.7. Well, if we are only using lipids, that means we've already gone through our glucose, we've already gone through our glycogen stores, we've exhausted glyconeogenesis, and now we're tapping into our stored fatty acids. So that reflects a condition of starvation. We're underfeeding patients if we see that. Whereas if we have anything over 1 for a respiratory quotient, when we have 1, let's say I'm imagining somebody in high intensity exercise who every glucose molecule you take in, you metabolize and use. If we go over that, we're essentially using more than we have. And so we are, I'm so sorry. When it's over 1, that's the net lipogenesis. We are taking in more than we're using. So we're storing extra, and we don't want to be doing that. That means we're overfeeding patients. Glucose is kind of that nice middle area where we're using as much as we're taking in, and it's a nice balance. But yes, when the fraction is larger than 1, it means we're exhaling way more CO2 than we need to be, because we're producing a lot more waste, and we don't need everything that we're taking in. So how do we calculate somebody's need? So we get a respiratory quotient. We're trying to figure out what's an appropriate adjustment. How do we best feed somebody what they need for their condition? Well, there's hundreds of formulas out there. The most common one that most people are probably familiar with is the Harris-Benedict equation. And essentially what this is estimating is it's providing an estimate of somebody's basal energy expenditure, or their basal metabolic rate, essentially the minimal number of calories that somebody needs for basic body functions at rest. This is like as soon as you wake up, you're in a fasted state, you haven't really done any activity yet. What basal energy do you need just for basic body functions like digestion, breathing, metabolism, things like that? And that requirement is going to be affected by your body size, whether you're male or female, your body composition, your age. And so the calculation is going to be different for men or women. It's listed right here. And depending on what resource you look at, you may see slight variations in these numbers, but they're essentially all giving you the same information. The one thing I will just point out is that this is weight in kilogram and height is in centimeters, not inches here, and age is in years. And then you're going to make adjustments on the basal metabolic rate, or basal daily energy expenditure, depending on what sort of condition or disease is going on with your patient. So if someone is febrile from an illness, they're going to have a higher metabolic need. And so for every degree of Celsius above normal, you can assume that you're going to multiply their basal expenditure by about 1.1. And for very stressful conditions, surgical, trauma, burns, based on whether you categorize that as mild, moderate, or severe, you can multiply that accordingly. So it's very helpful if we can look at labs, look at protein values in the blood to help us determine if somebody is malnourished. And historically, things like serum albumin, transferrin, pre